So welcome, welcome, welcome. My name's Kelly Victoria Thorne, and you're here because you've got wonky knees. So it's welcome to Prolonging the Life of Your Knees workshop. This is a masterclass, is a webinar. You can see me, but I can't see you. Which is probably, I quite like the fact on webinars that nobody can see me because I can sit there in my pajamas and go for a cup of tea when I feel like it. So feel free to do that. I've got people joining. Hello, hello. Okay, so I've done lots of webinars, but to be quite honest, this is the first time that I've done this one. So my apologies if I'm a little bit like stuttery sometimes, getting my words out. You get better at these things as you do them. I've talked about lots of stuff in my time movement wise. I've been doing this journey of 15 years getting to where I am today, which is working with wonky bodies and helping them get stronger and better. I've been all over the world learning pieces from this movement guru and that movement person and this person and that person, and kind of putting them all together in my own kind of framework in an effort to make myself as unbreakable as possible. And I'll give you a bit of my story and background as we go through. But for a long time, I was kind of just practicing what I'd learned for myself. I was just applying it to me. Roll on a few years and I started sharing it with my clients in lots of various ways. I've done lots of different movement. I've had a Pilates studio. I've done all sorts. So I've been at it for a very long time, but it's all been kind of pieced together, and it's taken me this long to really put this framework together of not just fixing knees. Knees are a big interest of mine, but fixing sort of all wonky bodies that have kind of started to feel like they're not your own anymore, or you get to 40 and you start getting out of a chair and making sounds as you get up. So I apologise in advance. This is a very Yorkshire accent, and you've got it for about an hour or thereabouts. And then if there's any Q&A after that, I'll fill you in or answer any questions that you've got. Right, so what I'm not going to do, I'm not going to give you a lecture on osteoarthritis or runner's knee, for that matter, which are the two main things that I deal with. Not the causes, not the outcomes, because I'm pretty sure if you're here, you've already had that kind of backdrop, if you like, from your physio and from maybe from your doctor or your surgeon, from whatever sort of stage you're at, if you have got any arthritis. This is more a case of, it's the broad overview. It's a short, an hour's not really long enough to go into any kind of real depth. This is an overview. It's the zoomed out 6 elements that are the main sort of, I don't know, they're just 6 elements that I've picked out that form the basis of how to make your body parts behave in a way that is less painful, more functional, and leaves you being able to move better, in theory. So like I say, knee osteoarthritis and runner's knee, they're my main two. And the reason why I am a runner, I have knees, one of them's got arthritis, I've had loads of problems with them. Also, those two things tend to respond really, really well to the things that I do. So movement, specifically the way that I teach the movement that I do, and the things that you do. So let's dive in. Let's get cracking. We've got 6 steps or 6 secrets to prolonging the life of your knees. Like I say, it's the strategy. It's the strategy that I teach people, the broad overview of wonky body parts. So starting off with step 1 then, or secret number 1, it's not what you do or what you've done, it's how you do it. So I'm going to give you like this broad starting point of how I came to understand that concept, because we hear it a lot. It's not what you do, it's how you do it. Or you might not have heard it before, for that matter, but I hear it a lot. I've been running since my teens. I've been going to the gym. I was a proper gym bunny. I loved exercising. Some of us love that kind of thing, some of us hate it, I get that. But I was starting to get foot problems, ankle, knee, IT band, hip, lower back, a whole heap of issues that no matter what I did, I just couldn't shake them. And I finished up going to the physio, like you do, who then sent me to the podiatrist, and the pair of them basically said, you'll never run more than 15 miles a week. And the podiatrist sold me then a very expensive pair of orthotics, told me I'd have to wear them for the rest of my life. because my feet had no arches, and all that collapsing was causing most of my pain and dysfunction, particularly in my knees. And I remember, you know, sometime after that, but I remember being on one of these, one of the courses that I went on, specialist biomechanics course, and there was 25 fitness specialists all there, me being one of them. They lined us all up. They lined us all up with the person with the highest arches at one end and the person with the flattest arches at the other, and then all the normal people in between. And I was the one on the far end. I had nothing, absolutely nothing. The lowest arches, the most collapsed, the knees turning in, no glutes, and the most knee pain. Not a huge surprise at that point, really. You know, it was about that time that I moved out to Australia to start doing some more specialist fitness courses. I was into coaching athletes and rehab and sports therapy, and eventually I became a Pilates teacher, I became a yoga teacher, strength and conditioning, CrossFit, you name it, I've kind of had a bash at it. And as I started listening to these people that knew how the body worked and why it seemingly out of nowhere started to break down, I started to have this little epiphany. I was like, well, maybe I'm not broken, and maybe it's kind of my responsibility to take back control and do something about these body parts that seem to be, it seemed to come out of nowhere. But the more I learned, the more I realized that it was how I was moving and what I was not doing, how I was doing it, what I wasn't doing, what I was doing, that were culminating in all these issues. I went on a bit of a mission. I travelled, I went to every specialist, every teacher, I learned, I listened, I put the pieces together in my own body, learning as I went along, learning. And the biggest thing that I learned at that time was that it wasn't what I was doing that was the problem, it was how I was doing it. You know, we live in very much in a culture that emphasises exercise over movement, and it wasn't until I started working one-to-one with these people, these various movement coaches, who could get eyes on and tell me exactly what I needed to do to move myself in ways that were better for me, better for my joints. You know, yes, my arches were non-existent, they were causing some issues, but the reason or the source of that or the cause of that, you know, I wasn't born that way. The cause of it was just weakness in the foot, and my feet were so weak from years and years of wearing shoes. Because my feet were weak, my shins, knees and thighs, the bones were not aligned because the muscles and everything were just not strong enough to hold everything where it should be. You know, sitting at an office chair for 14 to 16 hours a day. Previous life, I was a virtual assistant, self-employed. And as self-employed, you work like a dog. So I'd be sat for 14, 16 hours. So I had no hip mobility, no strength, nothing to support my needs at all. But I'd go out and I'd do my hour or 2 or 3 of exercise. But I was taking all of those misaligned, for want of a better way of putting it, misaligned, tight bits, weak bits, all those body parts, I was taking them with me into these high intensity exercise classes and taking them running as well. And they were tight bits, weak bits, kind of all pulling on my joints, all causing more problems rather than helping me fix them. So I was doing the work, thinking I was doing myself a favour, but I was taking this wonky body in. So I had to relearn essentially how to move in ways that supported my joints. You know, I learned how to strengthen my feet. I learned how to strengthen my hips, get more mobile through my hips and core so that my leg bones were better aligned, which in turn took pressure off my knees. It's kind of, I suppose I was learning to be more efficient, particularly when walking as well. You know, I like running, absolutely, but I've always liked walking and hiking. And it was the coming downhill, particularly, that started to put quite a lot of stress on my knees. So even learning how to handle downhill walking, how to use the muscles of my glutes and the outside of my hips to control my downward movement instead of the knee joint. It was all, you know, massive epiphany, and made such a huge difference to how I use my body and how it functions, and therefore how much pain that I was in. It started to go down, basically the idea. So how you move is vital. And the way you move right now is a combination of all the things that you've done in your life. So every every injury you've had, every sport you've played, how much you sit or don't sit, whether you danced as a kid, you did martial arts, what shoes you've worn, every little thing you've done is magic. There's a song in there somewhere in there. Every little thing you've done is imprinted on your muscles and your joints, and those are the things that dictate how you move. So it's because you move, right, so because your movement is just a culmination of habits, it's incredibly difficult to see yourself clearly. You know, you think that your body parts are in one position when they're not. You think you stood upright when you're not. You think your pelvis is over your ankles when it's not. And sometimes you just need somebody who can put eyes on, somebody like a movement coach, somebody like me, eyes on, to sort of see exactly where you're at and take you through it so that you can see where your body's at right now, particularly when you're moving, whatever movement you like, you know, particularly if you're exercising or doing whatever movement it is that you like to do or you have to do during the day. You can tell an awful lot from somebody just getting up out of a chair in the morning, anytime really, getting up out of a chair, getting out of bed. And this is kind of the first step, not just to help your knees, but to help your entire body, because your knees don't exist in a vacuum. They're obviously attached to your legs, which are in turn attached to everything else. There's a song there too, isn't there? Thigh bones connected to you get the idea. So yeah, it's not what you do, it's how you do it. Step one. Step two, your knees are unique, and so are you. I state in the obvious, but really, essentially, it's so true. You know, I learned very much, very quickly that my situation, my body was very different to everybody else's, and just because we suffered the same wonky, sore, painful body parts didn't necessarily mean that we could be lumped together when we were trying to get better or improve or make improvements or whatever, you know. And the physio at the time, he's giving me a generic exercise sheet. Here, go away and do these exercises. And the podiatrist just wanted to sell me some orthotics and keep me in them forever, make a small fortune out of me. But no one was really listening to me as an individual, you know, and hearing my unique story and all the things that have happened to me that make up who I am and how I move. So just as an example, when I did move out to Australia, within the first few months, I found out that I had cancer in my right butt cheek. Some people get breast cancer, you know, a lump in the breast. I got a lump in my right butt cheek. And as a result, I had to have a couple of surgeries to remove it, and now I've got what looks like a nice black tire in my pants. But irrespective, they removed quite a lot of tissue and some muscle, and by doing that, it created quite a significant imbalance on my right side. And I immediately came out of that surgery knowing or having started to learn what I know now. And I immediately went out and found somebody who could help me learn to rebalance myself, which was absolutely vital to stop me overcompensating on the other side and further wearing out what was already a sore knee. So you'll have your unique story. You know, you'll have all the events that have led you up to where you are today with your sore knees and sore other body parts, because usually they don't, you know, it's not just knees, they usually come with something else. You know, following online programs, I've done that, you know, watching YouTube, listening to Karen on Facebook, offering advice. It's just worth bearing in mind that what works for one person isn't necessarily going to work for you, and you can waste an awful lot of time trying to find answers to these body problems, answers to body questions, if you like. Whereas somebody like myself or another movement specialist, etc., they can help you work out exactly what you need to be working on right now in a fraction of the time, stripping away all that guesswork. You know, I'm thinking of a client, actually thinking about my client, Mark, who is he's a GP. He's actually an ex-client now because he's doing okay. He applies this stuff, he gets on with it, doesn't anymore. He's a GP, he was in his early 50s, and he wanted to run yet another marathon, but his Achilles was so bad that he couldn't run at all. You know, as a GP, he'd been working on himself, he'd been to all his mates, physios and what have you, but nothing was working. When he finally got to me, he was feeling a little bit depressed, really, because he wasn't able to run, and that's what he loved to do. And he came to me, I think where we started. I think we started on his feet. We developed his foot strength. We worked on rebalancing him left to right. I mean, he's he has actually got a leg length discrepancy by about 2 inches, which puts pressure all, it unbalances him. But because he was born that way, his body is compensated really quite well. But it was putting a lot of pressure through one side. He had a very dominant side. And when he was exercising, running, etc., he was taking that dominant side into his exercise, just reinforcing all the weaknesses that he had, instead of doing what he wanted to do, which he should have been doing, which is strengthening the side that was the problem. But once somebody's pointed something out to you and said, "Oh, look at that! What do you think about that? Do you think that might be, what about if we look at strengthening that or doing this?" And it is very much a two-way street. He started to realise what he needed to do, and he was able to apply it for himself. And he went out and ran another marathon, which was a massive. Imagine it was a massive thing for him. In fact, I think he's run another one since then as well. Thinking about it, anyway. So yeah, unique. You are unique. So are your needs. So where are we now? Step 3. Well, actually, step 3 and secret 3. Step 3 and step 4 kind of go hand in hand a little bit. It's about how you think, what you think, and how you think matters. About adopting what I do call a movement mindset, and reducing the amount of exercise that you do. And the reason why I plonk them together is because if you start to move towards a movement mindset, you start to move away from an exercise mindset. And that's what I mean by reducing exercise. It's not necessarily reducing movement, it's reducing our thinking about exercise. So going back to me, I was doing all the things. I was exercising every day, several times a day sometimes. I was wearing my orthotics religiously. Nothing was really changing. I mean, the orthotics took away some of the immediate pain, but they brought on other issues. They brought on other aches. They brought on other problems. And I think we all have this kind of mindset, don't we, that if something's not working, we should do more. We should do more. We should get out more. We should do more mobility, more exercise, more whatever, more. And lots of my clients always come to me and they're already doing so much. Their head's about to explode. They've just got no time. They've no time to fit everything in. I mean, I thought I was, I was doing the exercises the physio gave me sometimes, and I thought that would be enough, but the exercises, for one, they were really boring. I didn't really know why I was doing them. Nobody had ever kind of explained it to me. I'd just been handed this sheet and said, "Go away and do these." I was like, "How many? When? How?" And they just weren't helping. I was just a bit like. But once I started to work on my movement, on my exercise, how I moved in a more structured way, and applied what I was learning from my various coaches and teachers, I realised that I wasn't even doing the exercises correctly that they were giving me, but they weren't even tailored to me in my unique situation, like the point whatever above, secret number 2. Weren't really tailored to me in my unique situation. So I wasn't getting out of them what the physio was hoping I would get out of them. He didn't have enough time to listen to my situation. He didn't have time to coach me through the exercises. It was very much a case of, "Oh, you've got sore knees, your feet collapsing, go to the orthotics guy, get some orthotics, do these exercises and hope for the best." I was like, "Really? Is that it? Oh my God." That really doesn't fit in with my life goals. I want to be active now. I want to be up and running and moving and doing. And to be quite honest, I just didn't have enough time either to fit all of these corrective exercises that he wanted me to do that seemed not to be working into my already busy life. So the movement coach that I was following, as well, I still do, the person that I've learned a lot of this stuff from, a woman called Katie Bowman from the States, helped me to think more widely about what I was doing, and adopt a movement mindset. It totally freaked me out. When she said, "You're doing too much exercise and not enough movement." I was like, what? Isn't exercise moving? And if you're sat there saying the same thing, shouting at the screen, and with you, I was completely like, "Oh, my mind was blown." Yes, exercise, you are moving, but exercise is very much a man-made idea. We exercise for a reason. We exercise to prevent heart disease, so we can eat more pizza. That might just be me. And we do it in a very specific and very repetitive way. You know, we do the generic gym-based kind of program where you go sit on the machine, or we swim, we run, we yoga, we Pilates, but it's very specified. We do it for a certain amount of time, a certain day, at a certain time during the day, or for a certain distance, or a certain volume, or a certain time. And what I mean is, you know, if you're running for a certain time, speed-wise. And we usually do it in very limited and repetitive ranges of movement. You know, if you think about most of the things that you do in the gym or in exercise, it tends to be just repeated actions at joints that are, like I say, repeated over and over again. Some people don't even want to exercise, do they? You know, there's people out there that don't even want to do that, but they do want to stay mobile, pain-free, and energetic as they age. And that's where this idea of a movement mindset comes in. You know, what I was learning that because my body wasn't particularly well aligned, the exercise I was doing was actually just reinforcing all the things that I was trying to exercise my way out of, and then adding more of the same, which was my mindset at that point. Do more of what isn't working was just a recipe for disaster. And I came to understand, it took me a while to come to understand it, but come to understanding that I needed more movement in my life, more varied movement, not just the repetitive exercise that I was doing. And when I came to that understanding, I was able then to apply that to my whole life. So everything that I did began to support better movement patterns overall, so that I could alleviate pressure on joints. You know, like I say, everything started to get stronger because I was moving more throughout my day. It wasn't necessarily more time involved in that, but I was exercising in that repetitive fashion less, doing more of what was working, which then in turn allowed me to move back towards running more distance and those kinds of things. So yeah, it wasn't just the hour-long session of exercise anymore that was taking me closer to this ideal situation, which was going to be one niggle and pain-free. That's kind of where I wanted to get to. I wanted to be able to move without feeling discomfort and pain, either the same day, during, or after. And I want to get there as quickly as possible without necessarily adding more to my sort of exercise regime. So I started to make some simple tweaks to the things that I was doing daily. Started to make some tweaks to things that I was already doing exercise-wise, started to add some more movement to my day, walking more as well as running, transitioning even down to a barefoot shoe, which in turn developed my foot strength, which meant my feet were then free to move, which supported my knees, which then helped me then reconnect up to my glutes and get my hip mobility working. I had better flexibility, better strength, and with better movement comes less pain and the ability to move more, which is kind of what I wanted. You know, I wanted to be able to move more, I wanted to be able to do more things. I'd lots of stuff. I've done all sorts. You know, not just the running and the martial arts and things. There's loads of stuff that I wanted to experience that my body was just going to be. I knew that if I took my wonky body into those things, that I would just be making things worse. And yeah, that's ideal, is it? Trying to get better, not worse. You know, my client, again, previous client, because she's doing really well now. She, a woman called Sue, she's actually a physiotherapist. She was really struggling with back and hip pain, and she was exhausted when she got to me because she couldn't sleep at night. And she knew every exercise, she knew what she had to do, she was doing it, and it wasn't working. She just couldn't get any relief. And by the time she got to me, she was just completely confused about why, when she had all this knowledge and she had all this experience of working with bodies, why what she was doing wasn't working. And it, you know, it's quite clear as soon as I saw her that she was very much out of balance. You know, she had this tendency to stand with all the weight on one hip, which happened to be the sore side. The pelvis was way out in front of her. She had this tendency to stand with the pelvis out in front of her, and her ribs. She wasn't breathing particularly well, very high up, so she had all this neck tension, and she really couldn't, you know, she kind of lost touch. This happens quite a lot. You know, I think because we don't move as much as perhaps we should or we could, your body almost like your brain kind of forgets or can't really tell where your body is in space anymore. And sometimes it's quite easy. Well, it sounds simple, doesn't it? Kind of reconnect your brain and teach your brain where your body is in space so that it can align itself better, so that you relieve pressure on the parts that are sore, whether that's hips, backs, knees, feet, etc. You know, and over several weeks, Sue managed to reconnect to her body. She started to work out in her own body, in her own mind, what she was doing, these movement habits that she had that were reinforcing again this pain that she was trying to relieve herself of. It wasn't that the bits of exercise she was doing were useless, but it was the fact that the rest of the time as well, the rest of the time she was just kind of doing the same things over and over again. It was like she'd do the exercises, that was fine. She'd do half an hour, but then 23 hours, she's undoing all of that by the movement habits that she wasn't even aware that she had until somebody kind of goes, have you seen that you do that? And she, oh yeah, do I do that? We've been doing it all the time that you've been with me. And if somebody kind of points that out to you, you kind of go, oh my God, because you just can't see it in yourself. So anyway, where are we? Oh, how are we doing for time? Not so bad, half past. I'm very conscious of your time as well. I appreciate it because I'm kind of rattling through a lot in my very broad Yorkshire accent. So well done if you're still here. Step number 5, or secret number 5, it's not your age and your environment moves you. So one of the things that I hear most from any new client or anybody that comes to me and gets on a call with me, or I meet face to face, because I still do that with people that are local, which is nice, is, I'm getting old, I'm getting slow. It's just that I'm old. I'm not as mobile because I'm getting old. My age, not quite as flexible anymore. Used to be supple, but now I'm old. That it's their age that's caused their knee to degenerate, or that they did too much sport when they were younger, or they did too much running or whatever when they were younger. It's not true. It's not true. It's a myth. It's not the case. I mean, yes. I get that age does cause changes to the body. Absolutely does. But they don't have to be the big changes that they are for a lot of us, particularly around mobility, strength, balance, those kinds of things. I mean, if age caused our joints to deteriorate, then everybody who got to a certain age would have the same degeneration in their joints. And we'd also get joints deteriorating on both sides at exactly the same and equal rates. If it was just age, you know, but that doesn't happen. You know, one knee is deteriorating more than another, and not in a person who's the same age, you know. And the reason why, or one of the reasons why, is partly like we discussed, which is your unique history. You know, everything you've done, your movement habits, your well, like we talked about, everything about you that is unique. So everything that's led up to how you move now, those are the things that cause problems with strength, mobility, deterioration of joints, etc. And part of that is your environment. So this is what I meant by your environment moves you. So it's not your age, and your environment is very much what matters. And when you're like, what's my environment? What's that? Well, it's this. It's this, you know. As human beings, we like to be comfortable. You know, we organize our lives around comfort. We don't like to be uncomfortable. We like it. You know, we have cars to take us from A to B because we don't want to walk. See, walking's either too time consuming, boring, or too slow. We've got sofas, chairs, beds, benches, rugs. I'm trying to think, blankets, cushions, mats. I mean, I'm sat on blocks here. You know, a nice warm rated, lovely floor that's flat and level, or cushioned, or carpeted, or even heated, you know. So your feet are always walking on something that's flat and level. I mean, outside, the environment is very much the same. It's comfortable, you know. Your roads are paved and landscaped, flat, level for the most part. You know, if you are out walking, and how often would you go, if you've got a piece of pavement and next to it is a piece of grass, how often do you walk on the grass? You don't, because it's a lot easier to walk on the pavement. You don't want to walk through long grass, you know. So for the most part, we're walking on flat level surfaces. So your feet never do anything. Put some stuff into shoes, but I mean, don't get me started on shoes and ranting and barefoot and all the kind of rest of it. But well, even there, you know, we're told that wearing comfortable shoes, you must wear comfortable shoes. That's the way to go. And if your shoes are comfortable, then they must be absolutely good for you. And they might be good for you, but not good for your not good for your feet or building strength in your foot. Anyway, the problem with comfort is it stops your body from moving in lots of different ways. Your body is designed really to move in all sorts of different ways throughout the day, much like, and I don't want to bang on about this too much, but much like if you were having to forage for food, if you lived in cave, swung from a tree and fought off a saber-toothed tiger, you'd be moving in lots of different ways over long periods of time. And because we don't have to do that anymore, because we've got these basic, comfortable, easy, for the most part, very stressful, very busy. We've all got our woes, but for the most part, from a movement perspective and from the perspective of your body and what it understands, what it feels, what the input that's coming in, we're very, very sedentary, even if we do a lot of exercise. We're adopting the same body positions over and over, like I talked about in exercise. If you're a runner, you run, you're doing the same thing over and over. If you do yoga, you like yoga, you do yoga, you're doing the same thing over and over. It doesn't really matter what you're doing exercise-wise, it tends to be repetitive in nature. And that's not how your body is designed to move. By repeating those motions over and over again, you're only taking your body through quite a very limited range of movement. And your body's clever, it's very clever. It's there to survive. So that old cliche of if you don't use it, if you don't use it, you lose it. So it is a cliche, but it's so true. And I don't think we really think about that too much, in that we think that we're moving, we think that we're busy and we're out and we're doing, and we think that the exercise is enough. But we're only moving, like I say, in very limited ways. And as a result, the body kind of goes, well, she's not using that particular movement or that body part. And so it starts to just ever so slightly restrict the movement that you've got there, take a little bit away from here, a little bit away from there, and a little bit from here, a little bit from there. And she's not doing that anymore, take away that and that. And she never goes down to the floor, never kneels up, never lies on the floor. She's going to take that away. Never squats beyond 90, she only just get into chair level. All these little things that in and of themselves are small, over time mount up. And eventually we say, oh, I'm just getting old. Getting old and losing my mobility, my flexibility, my strength, my balance, my knees deteriorate, whatever it is, it's not age, it's just length of time that you've kind of just not used your body in the way that you've kind of noticed that all of a sudden you can't. So maybe you used to, I'm going to take this as an extreme example, right? But maybe you used to do the splits and now you can't. Maybe you used to be able to get down into a full squat, now you can't. Maybe you used to be able to put your socks on without having to sit down, and contort yourself and make lots of funny noises. Maybe you used to be able to balance on one leg, put your sock on, put your shoe on, tie your laces up and not have to put your foot down. They're all little things, but once they start to go, you don't really notice that they're going. And then it's all of a sudden, I'm old, I'm making funny noises, I get out of my chair, my knee's not working properly. And it's not age, it's basically, it's lack of use, or not using it how you should, or not using it enough, or using it too much because something else not working. Oh God, blah. But what I'm saying is, you don't have to exercise your way out of knee pain away from surgery. Making these changes to your mindset, such as thinking less about exercise, more about movement, more throughout the day, making some tweaks to your environment. This is a for instance. I could have sat here tonight. I could have sat at. I've got a desk. I've got a nice comfy sofa. I've got a bench. What I'm actually here, I'm sat on one of these. I'm just sat cross-legged on a block, and that's why you'll see I'm moving about a lot. I'm kind of here, there, and everywhere because it's uncomfortable. It's uncomfortable to sit on the floor. And what I mean by that is your body kind of goes, oh, you've been sat with your legs crossed for a while. You need to move to like a side sitting position, or put your legs out straight, or bring them up in front, or lean forward, whatever it is. But I'm constantly kind of having to fidget because it's uncomfortable being down on the floor. Whereas if I'd have been sat on the sofa, I could have sat there for 4 hours and not had to move. And I think we've all experienced that. You get watching Netflix on a night and you realise you've been sat on the sofa binging a series. You've not moved for 3 to 8 hours because it's so comfortable, which is great. But then you get up and your body goes, hang on a minute, wait a minute, I was comfy there, and I was in that position for that long, and it's why you can't stand up straight, and everything hurts when you do. Oh, right, yeah. So we're talking about essentially treating the cause rather than the symptoms. So if we're saying that sitting in one position for too long is causing your, let's say, it's creating a lack of mobility and strength in the hips and the glutes, which in turn causes the knees to overwork. Then changing how and where you sit might help. You know, even spending some time on the floor. You can watch Netflix sat on the floor for a while. Will just take your body through a different range of movement, particularly hips, which are, you know, hip movement, hip mobility, massively important for knee function and knee everything. Your knees essentially, I wasn't going to get into the anatomy tonight, but I think it bears mention. So I'm going to bring it up here. So your knees obviously in between your foot and your hip, and you've got tons of movement at the foot. Here's my foot. You've got tons of movement at the foot and ankle, tons of movement at the hip, and the joint in the middle should be stable. So mobile, joint in the middle stable. Same with your arm, loads of movement, hand and wrist, loads of movement, shoulder, stable joint in the middle, the elbow. So if your foot and your hip aren't pulling their weight and doing what they should do, you finish up with a knee that is either being pulled out of alignment or having to do the job of moving more than it would do if your other body parts were more mobile. Is essentially what I'm trying to get. So, you know, this is a real mind boggler for a lot of people when I get into this one. But the more cushioned your shoe, the more impact you have on your knees. And people are like, oh my God, that's weird. And what it is because the cushioning of the shoe protects your foot from the impact. The impact doesn't go away; it has to go somewhere, and it goes up the chain. And the next joint up to really feel it is the knee. So that even things like that, you know, things like changing your shoes. You have to go barefoot. You have to go to a minimalist shoe and spend a fortune on minimal shoes. But just having that insight of, hang on a minute, if cushioned shoes are going to create more impact on my knee, and I spend my life in hookers or trainers that are cushioned with a heel, anything like that, then it's kind of like, well, next time I change my shoes, maybe I'll go for something that's slightly less cushioned and see if it makes a difference. Yeah. So I'm talking about age, aren't we? So I've gone off on a complete tangent. I'm good at that, especially when it comes to feet and shoes, because they can have such a big impact on the rest of the body. I find it fascinating. I should have made this a foot webinar. Yeah, so it has nothing to do with age and all to do with how much you move or don't move throughout the day, your life. And it's not just the big parts of you that, you know, we need to move, like the big parts, hips, shoulders, knees. It's the little parts. Even down to, I'm going back to feet, even down to your toes, which are meant to grip the floor when you walk. They're meant to spread and grip the floor as you walk to help you balance and to give you more stability. And when they're not doing that, because they're in shoes, particularly cushioned shoes, then the knock-on effect is straight up into your knee. I could go on at this at massive amounts of length. If you have any questions about that, please just send them, because I'd be delighted to speak to you about it. I find it absolutely fascinating. It was the game changer for me. Absolute game changer for my knee pain was sorting my feet out. Yeah, I can't emphasize it enough. So the last one, step 6, secret number 6. It's never too late. And knee surgery is not inevitable. So, you know, you might have I hate this word, but I'm going to do it anyway. You might have been told, you know, if you've got knee arthritis, you might have been told, have your scan, and you go back to the doctor, and they might say, you know, you're born unborn, you've worn your knees out, and a bit like my physio and my podiatrist both telling me that I'd never run past 15 miles a week. You know, I'd have to wear these orthotics for the rest of my life. If I continued to run or walk without orthotics, I was going to be more injured and get more knee pain and arthritis, and I was heading towards hip replacement and knee replacement as I got older. I'm just going to go out there on a limb and say this, it's total bullshit. That is not the way the body works. It just isn't the way the body works. You know, you may have had, this is the pains, I'm not going to go into pain science in great depth. You may have had x-rays that show bone and bone changes. You may have had x-rays that just show slight degeneration. And the research around pain absolutely clearly shows that irrespective of what your scans say, that's not an indication of how much pain you're going to suffer or how much pain you're going to be in when you move. It's not an indication of how close to surgery you are per se, right? Because most people elect to have surgery not based on the scan, but based on how much pain they're in and lack of function, you know, lack of quality of life, I suppose is what I'm saying. So you can have very small changes on your scans and be in massive amounts of pain, or you can be bone on bone and have absolutely no pain whatsoever. So pain is a science and it's a whole thing all on its own. But a sort of a good way to think about it, or a way to think about it, is if you've ever heard of phantom limb syndrome. But when somebody has an amputated limb, so somebody has their arm chopped off for whatever reason, but they can still feel it. They can still feel like they've got a hand, and they get immense pain in the hand time to time, but it's not there. And this is why do they feel it if their arm's not there? And this is how the brain, there's a lot of research out on it. It's really fascinating stuff, and some people doing some really clever work, especially around the phantom limb and trying to bring on signals of pain, even though the body isn't in pain. But basically what we're saying is that the amount of damage that is showing up on your scan is not necessarily related to how much pain that you either are experiencing or are gonna experience in the future. So, you know, the body and the brain work in mysterious ways. It's that simple. There are a lot of factors that go into why your body experiences pain and the inflammation in the knee joint that usually goes with it. The obvious: diet, stress, weight, and other chemical and biological or hormonal kind of factors in the body. And that's kind of beyond the scope. It's kind of beyond the scope of what we're talking about tonight. But essentially, you know, I'm walking proof that it's never too late to make some changes, and that your body will respond, and your body will respond like a dream. You know, your body is busting, absolutely busting for novel, different types of movement. Not hard, not pasting yourself at the gym, not deciding to run a marathon tomorrow, but it looks for different types of movement. And that can be as simple as, like I said, just making some changes to your environment to make it more movement friendly, standing up more, sitting on the floor more, not sitting in the same place, switching sofa, switching, you know, if you sit and watch Netflix on a night and you always choose the same spot on the sofa, choose a different sofa or the other end, so your neck's in a different position. They're all little things. They're lifestyle things. I mean, that's kind of what this is about tonight. We've not kind of gone into the whole movement and exercise and there's all sorts. You know, essentially, I needed a guide to start with, someone to work with to make sure I wasn't doing too much, that I was slowing down, to really understand how my body worked. But essentially, until the last day that you draw till the day you draw your last breath, your body will respond to whatever you do with it. That's how bodies work. They don't know that you're exercising, they don't know that you're moving, they don't know, they just feel what you're doing and respond accordingly. All that being said, what that means is that you can look after and improve and work on the cartilage that you have left. So even if you are bone on bone, typically your knee joints come together and you'll be bone on one side and not necessarily on the other. So there is cartilage left in there. You can certainly improve the health of that cartilage. You can improve the health of the knee joint overall. You can create more space in the joint. So all joints are in the body is a space, and that space allows movement. It's when the space starts to close, the space starts to close that you get the potential for deterioration. You get the friction, you get the inflammation, and eventually get I'm calling it wearing away. It sounds like there's some kind of sandpapery kind of thing going on, and it's not really like that, but let's call it degeneration or deterioration. So you can create more space in the joints. There's lots of ways of doing that, releasing off joints, but essentially that can and will reduce the amount of pain and the potential flare-ups that you experience. What I'm not saying, you know, I can freely admit that nothing in the body goes from A to Z in one line. You know, it's not linear progress. It's a series of ups and downs. You have some days that are great, some days that are worse than others. And certainly I know from my perspective, it was a case of changing my mindset to one of curiosity rather than, you know, oh my God, here we go again. It's all going wrong. That was me, necessarily you. You know, I was dejected. I was fed up because I just couldn't work it out. I was like, I appreciate that I've done a lot of work and I've been all over and I've worked with lots of different people and I've got all this knowledge now, this skill, which is what I'm desperately trying to impart to the world. You know, but that mindset of curiosity and the days when things aren't functioning as well as they should, it's kind of going, oh, what have I been up to? No, what did I do yesterday? Oh God, I had a really bad day yesterday. My mum wasn't very well and she needed to go to the doctor, and yeah, I was a bit stressed, and then and I didn't eat particularly well, and blah blah blah. You get the idea. Yeah, there's lots of things that go into why some days are worse than others in terms of pain in joints, particularly is what we're talking about tonight. Pain in general, really. You know, lots of external factors that we don't really think about, not necessarily just the fact that you're moving. So it's trying to shift away as well from that concept or that idea that if you use a joint, it's going to get worse or it's going to deteriorate quicker. I hear that a lot, and that's kind of sad, really, because it implies that whichever doctor you're seeing or whichever physio or whichever medical professional you're seeing for this, and you should, you know, I'm not dissing the medical profession, definitely not. I'm not a medical professional. I don't profess to be one, but I do wish they would explain in greater detail how important it is to keep your joints moving, because the health of the joint is entirely down to how much it moves and how it moves. So we've already talked about this. You can do too much. You can stress your joints in various ways. If, like I say, if you're not in great alignment, if muscles are tight and weak, or you've got an imbalance of those kinds of things, then obviously moving with those imbalances can cause, you know, more discomfort than, I'm not going to say harm, but it can cause problems. Let's go with that. So you want to make sure that you're moving in the right way, absolutely. You want to make sure that you've got the mobility and the flexibility and the strength, that all three of those go together. So you get curious about why you're moving in a certain way, you get curious about why one day things are worse than others, but know deep down that the health of your joints is dictated by how well they move. They're like a squeaky hinge. If you neglect a hinge, eventually it seizes up and it squeaks when you open the door and creaks. You put some oil in it and there it goes, it's free again. And essentially by moving a joint, knees are a good example. By moving the joint, you're pumping fluid in and out of the joint, flushes out all the crap and keeps the joint lubricated and moving. The worst thing you can do for a joint is stop moving it. That being said, there's a caveat there, which is if you, and I'll talk about it at the end as well, if you're in severe pain all the time and it's stopping you sleeping, but I'll come to that in a little bit, as it's usually one of the questions I get asked anyway. Like I say, I go off a tangent quite a lot and lose my spot. But I was convinced I had written off my feet, I'd written off my knees. Oh God, I'd heard that much negative talk from the people that were supposed to be looking after me about how broken I was, that in my mind as well, I might as well have just crawled off into a corner, curled up in a ball, and just let my life pass me by, not doing all the things that I wanted to do. And I trusted them with my body parts, and they had me convinced that it was absolutely inevitable that I was never going to live an active, pain-free life. And all right, it took me a long time, a lot of work to get past that mindset, and it's that's one of the main things that I teach anybody who comes to me with their wonky body parts. But more pain and degeneration is not set in stone. Yes, arthritis is progressive, unfortunately. It usually does progress in some fashion, but that doesn't mean that you will definitely end up needing a knee replacement. And even if you do, there's an awful lot you can do in the meantime to reduce the amount of pain that you're in now, to gain more movement, more stability, more flexibility, like I say, and relieve pressure on the joint, and to delay that surgery as long as possible. Like I say, if you do need a knee replacement at the end of the day, eventually, everything that we've talked about tonight and everything that you can do, either with me or somebody else, is it'll leave you with better surgical outcomes. So even if you do go in, you'll be healthier, your joints will be more, or the muscles and the tissues surrounding your joints will be a lot healthier. And therefore, when you come out of that surgery, you're going to be in a much better position, you know, from a rehab, rehab position. Oh, I think we're nearly there. I don't know whether I've got anything else to talk about. I think I'm doing okay for time. You know, most of my clients come to me when they're mid to late 40s. That's when things start to go wrong. I've had clients in the 60s, 70s, 80s. But aside from having wonky, painful body parts, what they've had in common is a strong desire to make change and a belief that they could. You know, they weren't going to be told that they were done, that the joints were worn out and there was nothing that they could do for themselves anymore. They come with this idea that they're going to get better, that they're going to put the effort in to get the most out of the movement in their life. And really all you need is, and to make these changes, is the desire, the commitment and the consistency, and consistency being the key one. If you can make consistent changes, daily changes to your life, they don't need to be big, they just need to be consistent. You can make some serious progress. Oh God, so we've been going for about an hour. Let me just give it a dead quick recap. We've talked about how it's not what you do, it's how you do it, partly. How your body is unique, your needs are unique. You know, like working one-to-one with someone who understands your unique situation can help you achieve a lot more success and you know, less pain, more movement in a much quicker time frame. We've talked about how you think about your movement, your pain, and how you think about your abilities can massively impact your knee function, and that exercise isn't necessarily the be-all and end-all, and that lifestyle changes and this sort of concept of movement on a more, from a lifestyle perspective and on a more regular basis, that's more important. And it means that anybody can achieve success. You know, you don't need to be an exercise fanatic, you don't need to go to the gym, you don't need to be going out for a run. It's just thinking more widely about your movement in your body and how it works. And then finally we sort of we covered it's never too late to make some positive changes, and that even if your knee arthritis does get worse and surgery becomes the only option, then having a body that where the rest of it functions really well will leave you in a much better place for when you come out of that surgery from a rehab and a getting better perspective. You know, so I know I'm into movement. I use movement, lifestyle, mindset, etc., to make massive changes in people's lives, the bodies, the knees, etc. You know, I went from this buck cheek cancer and knee problems and collapsed arches and weak feet, and that them telling me you never run past 15 miles a week. And in 2012, I did the Himalayas 100-mile stage race and stood looking at, I was in India, I was thinking whether I was in Nepal, but I stood on the Indian border looking at Everest and thinking about that physiotherapist and that podiatrist, and laughing, quite smug. Good feeling, and not a single blister, unlike everybody else that was on that mountain with me. And you know, I get you sat there kind of thinking, well, I don't want to. You know, it's all right for you, Kel. You were in your 30s and you wanted to run 100 miles up a mountain in India, but I'm 57 or 63 or 98. I don't want to run 100 miles. Thanks very much. And you're quite right. It was really hard work. I would recommend it. It was really amazing experience. But you know, you might not want to run 100 miles up a mountain, but what if you want to do even just 10% of that, and you want to hike 10 miles, or even 10% of that movement could manage a mile in a day? Maybe it's not a movement goal that you've got. Maybe you just want to get down onto the floor to play with your kids, or you want to kick a football around with your grandchildren. Maybe it isn't movement goals at all that you've got. Maybe you just want to get some pain-free movement. Maybe you just want to have a week or a day or a few hours or a better night's sleep where you're not constantly getting it might just be discomfort, it might be niggles, it might just be pain, might be pain. Maybe you just want to move away from that and get some relief. And you know, what are those things worth, really? You know, it might not even be your knees that need sorting out. What about the rest of you? You know, knees tend to come with other stuff. You might come with tend to come with back pain. You know, I kind of see a lot of people with knees and backs, or knees and hips, or knees and feet, really. Try to think what else. Usually some other niggle showing up somewhere. And you can't tie your shoelaces, or you can't play badminton, you can't do whatever it is, getting to and from the floor without having to push up with support, or get out of a chair without using your hands, you know, where everything's kind of seizing up. You know, what about just getting back to that sort of semblance of who you used to be, instead of accepting that your body is getting old and slow and that it's inevitable? Because it isn't, it's not inevitable. I mean, like I say, it's not smooth sailing. Bodies are fickle things. Sometimes they're up, sometimes they're down, sometimes they're in pain, they have good days, bad days. But what if you could get more good days to outnumber the bad? Right, so, you know, we've covered a lot. Let me ask you a question. You know, I don't want you to leave here overwhelmed with everything that I've kind of whittled on at you about. And I can't show you the nitty gritty. This is like scratching the surface. It's the tip of the iceberg. All I've done is kind of take this bird's eye view of some things to think about. They're like the big rock. If you've got a jar, the big rocks that are put in the jar. The sand, the nitty gritty, the exactly how you go about it is it take me a long time, long time. You'd be here for hours and hours and hours, and I'm conscious of your time. So I've just outlined the overarching strategy. I mean, you know, let me ask you a question here. Is it okay if I just spend 10 minutes explaining to you that how exactly I go through or put together this offer that shows you exactly what you as an individual need to do to prolong the life of your youth? Essentially, that's what we're talking about. I want you to have the same result as me, the same results as my clients, and I'm kind of building this unbreakable body, or if it is, you know, slightly wonky and slightly broken, a little bit bent in the middle, we're trying to straighten it out a little bit, trying to get it moving better, trying to take you away from pain and more towards doing the things that you want to do in your life. And that's what I've done. You know, I've created this, I call it program, a course, a training. It doesn't really matter what it's called. It's about, like I say, shifting your mindset, thinking more about movement and prolonging the life of not just your knees. I mean, it's a catchy title for tonight, and it is about knees at the end of the day, but it's about organising the rest of you to take the pressure off the knees. There's a lot of stuff you can do for the knee itself, partly with, you know, the muscles and tissues that surround the knee. But, you know, we're looking at the body as a whole, essentially. So, I mean, what I do, just to give you some idea of where we're at with what I do, when you work with me as a coach, what I typically do with people is it's a full movement and gait analysis, so you know exactly where you're starting from and what you need to work on. So no generic exercise programs, no trying to follow an online class or a pre-recorded this, no guesswork, only what you as an individual need to be doing right now. I tend to do it in 12-week batches, 12 weeks of one-to-one coaching and support. Excuse me, I'm just going to be wittering for an hour. Excuse me. So 12 weeks of one-to-one coaching and support to take you from where you are now to where you want to be. And this one, it's individualized and one-to-one, because, you know, where you want to be, your goals are going to be very different from somebody else's. You might want to be moving towards your next marathon. Might want to be playing football with your grandkids, like I said, or just getting that pain-free time so you can enjoy life more. It might be just understanding your body better, getting more comfortable in your skin, and aging more dynamically instead of deteriorating. So I give out lifetime access to all the resources that I've created and that I will create for you to achieve whatever success or goal that you're looking to achieve. My thoughts are to create some group sessions, mainly because it helps keep people motivated. What I find is it helps keep people motivated and on track and committed and consistent if they've got a little bit of community rather than just my support. And lastly, I fully guarantee all my coaching. So if you're not happy in any way, shape or form, I refund fully. Never had to do it, never even been asked in 15 years. So there's no risk really at all. I only work because it's one-to-one, it's personalized, that's it. So I can only work with a handful of people at a time over the 12 weeks. And I use these webinars as a way of introducing myself and what I do, so that you can get an idea of who I am. You get to meet me, you get to hear what I've got to say. If you're still here, you're obviously are semi-interested, otherwise you'd have switched off and wandered off. I've gone and made you a pot of tea. So, like I said, this is the first time I've run this webinar because it's a new training that I'm offering. I usually work with people that have got, you know, I've worked with knees, obviously, worked with all sorts of body parts, but I've never put together a full program for a specific body part. So it's new, it's completely new. And because it's new, it's going to feel a little bit, it's not going to run quite as smooth as my other coaching does, just not going to happen because it's new. So that 12 weeks of coaching with me, the resources, etc., I'm offering 50% off until Sunday. There's only 5 places, and after that I'll be charging what I usually charge for 12 weeks of coaching, which is £2,997. So half price until Sunday. So for all of that, the individual coaching, the movement analysis, the data analysis, the resources, the group sessions, anything else that I do within that 12 weeks, all yours, and fully guaranteed as well. You get your money back if you're not happy. And I'm offering that at the moment for £1,498. So if you're here today or you're watching the replay and you know something needs to change and now is the time, then by all means, I'm going to invite you to apply for one of those spots. All you need to do is complete the online form and book a consultation. It's a 30-minute free chin wag, face-to-face, well, Zoom face-to-face, as much as that is face-to-face, to make sure that we're a good fit. Essentially, I'm not going to try and sell you something when you've not spoken to me, and you shouldn't buy it until you've spoken to me, because we need to make sure, that, we get on when we meet. You've got 12 weeks to spend with me. You need to be sure, even though, like I said, if you're not happy, get your money back. So you don't need to be that sure to start with. But yeah, hop on a call. Let's have a chat. If I think I can help you, I will say so, and you're more than welcome to one of the spots if you want it. And if not, that's okay too. I'll drop the link for booking a call with me into an email for you. In fact, I might have already sent it. I think I might have sent it. I think it's like an automated sequence, so it's probably sat in your inbox. But it's just my website, kellyvictoriathorne.coach /knee-consult. So kellyvictoriathorne.coach /knee-consult. So, like I say, it's there in an email waiting for you. It'd be nice to speak to you. If you've got any questions, I'm not going to sell to you on that call. That's not what it's about. You've got the price, you've seen me, there's nothing to sell. You either want it or you don't, and that's absolutely fine. But because you've been here, and if you've got any questions, if anything I've said hasn't made sense, you want to chat, pick my brains, book a call, come and say hello. It won't do you any harm. So I had some questions come in. It's coming up to Christmas. Can I start in the new year? Yes. Yes, by all means. Actually, I mean, that's not a bad idea. Actually, I'm quite happy to hold anybody's spot so they can start in the new year. I appreciate that coming up to Christmas is not the ideal time to be kind of focusing on stuff. You've got family and everybody's busy, aren't they, and all that kind of stuff. What else? I'm limited on time. How much time will it take? That's a really, really good question. But really the answer is, how long is a piece of string? Depends on you, depends on your body, your goals, what you want to achieve, where you've been, where you're at. My focus is always very much on getting you the most bang for your buck, not dragging you down with pointless, lengthy extra bits to add to your to-do list that you probably won't implement. So when we do any kind of, when we onboard, is what I call it. So if you decide to work with me, the first session is all about learning where you're at. Who are you? Where are you? What do you want to achieve? Where do you want to go? How are we going to get there? What can you commit time-wise per week? How do you like to learn? Do you like to learn by video? Do you like to learn by face-to-face communication, by text, by writing, by WhatsApp? That doesn't matter. It's all about you. So It very much depends on you, but this is why it's one-to-one. It's not a group, it's not generic, it's one-to-one because it's tailored to you. And that includes how we deliver the information and how often. Oh, right, okay, so I'm in pain all the time. I'm struggling to, right. This was what I was actually going to mention, wasn't it? So yes, the red flags for me are always somebody who comes to me and they say, I'm in pain constantly. I mean, constantly, and I'm in pain, I can't sleep because I'm in pain. At that point, this is a difficult question because I don't know your particular situation. However, if you're at that point, usually movement isn't helping. So most people will find that movement can help reduce pain and flare-ups, but those people that are experiencing continuous pain and inability to sleep, they usually find that movement doesn't help. And in fact, it irritates the joint more and more. And while some lifestyle changes, diet, weight, those kinds of things can help alleviate some of the pressure on the joint and reduce the inflammation, at that point, you definitely want to be chatting to your GP, your physio, or your surgeon to make sure there's nothing sort of more serious or sinister going on, just to be on the safe side. I'm still more than happy to chat to you, even if, like I say, if you just want to pick my brains, that's absolutely fine. But I wouldn't try and sell you a movement-based program if I didn't think it was appropriate for you. That's simple. I'm an 47-year-old ex-rugby player. My knees are shot, my back hurts all the time, and I can't move one shoulder. I feel like I'm old before my time. Is it possible to regain mobility after all the injuries I've had? That's a biggie, isn't it? Yes. The short answer is yes. It's always possible to make some improvements to your mobility, flexibility, strength, balance, overall movement capability. How much depends on you? It depends on your previous injuries. It also depends on your commitment. At the end of the day, I can only facilitate. I can only, facilitate, encourage, offer suggestions, throw loads of stuff at you to pick out the pieces that work. I wish I had a magic wand. I've been 15 years working with bodies, wishing I had a magic wand to get people exactly where they want to be. But if you're prepared to put in the time and the effort and the consistency, then yeah, absolutely. Like I said, until the day that you draw your very last breath, your body's perfectly capable of changing and getting better and making improvements. It might not feel like it to start with. Like I say, it's all a little bit like this. Some days are good, some days are bad. But as long as you're heading in roughly the right direction, then we're on to a winner as far as I'm concerned. Any more questions? Checking on. No, I think that's it. I'm conscious of the time anyway. I said about an hour, didn't I? I'm 10 minutes over. There might be somebody typing there. Any more questions, feel free to, like I say, either book the call and ask the questions directly, because it's a lot easier. I can answer it more specifically anyway. Or send me an email. You can always drop me an email and ask any questions. I'm delighted to hear from you. Don't be shy. I don't bite, even though I sound very Yorkshire and like I might bite. So anyway, I'm taken up a lot of your time. I do appreciate it if you've turned up to watch this live and you've put up with an hour of me waffling. I hope you found it useful. If you are interested in working with me, go ahead, book one of the calls. Like I say, no obligation. You can book a call to chat, ask questions, pick my brains, or if you're interested in working with me in the program, book the call and we'll chat about it and see if we're a good fit. See if I can help you and see if you like me. That's the most important thing. We've got to get on at the end of the day. And that's kellivictoriathorne.coach/me-consult. The booking booking widget is there. You book a time. If you can't find the time that you're looking for, drop me an email because I can usually free up something in my diary. The booking kind of widget just picks out spaces in my diary, but there's usually stuff that I can do weekends and stuff like that if you need it. So I will leave you there. Thank you again. I do appreciate your time. and it'd be nice to speak to you face to face, even if that is on Zoom. So give me, fill in the form, send me your details, send me your questions, comments, etc. And I'll hopefully see you at some point very, very soon.